So in this we study the competency, that is boundaries and contents of superior, anterior, middle and posterior mediastinum. So in this picture you can see the mediastinum, that is one imaginary line is there that passes from the sternal angle to the junction between 4th and 5th thoracic vertebra. Above that imaginary line, that is the superior mediastinum. Below that is the inferior mediastinum. And inferior mediastinum is divided into three parts by the pericardium and heart. Anterior to pericardium is the anterior mediastinum. Inside the pericardium is the middle mediastinum, and posterior to pericardium it is posterior mediastinum. The mediastinum is the chest cavity region, located as a septum between two pleural cavities. It is an area of great interest to internists, pulmonologists, imaging specialists, thoracic surgeons, pathologists, because it can be the site of origin of numerous pathological processes. Many clinical problems associated with the mediastinal lesions have become apparent with the development of sensitive new radiologic techniques and use of invasive diagnostic procedures. Extent. It extends anteroposteriorly from the sternum to the thoracic vertebrae, that is T1 to T4. Sagittal from thoracic inlet to the diaphragm. Its boundaries include sternum anteriorly, thoracic vertebra posteriorly, first thoracic ribs, first thoracic vertebra, and manubrium superiorly, and diaphragm inferiorly. Anatomic classification of mediastinum. There are several anatomic classifications of mediastinum. Most widely used is the simple one that divides the mediastinum into four compartments: superior, anterior, middle and posterior. This classification is useful as certain pathologic lesions are most frequently located in a particular compartment. For example, thymic tumors are usually in the anterior mediastinum, whereas neurogenic lesions are found in the posterior compartment. So, anatomic compartment superior. Superior mediastinum extends above a line drawn from the sternal angle through the lower edge of the fourth thoracic vertebral body. This is the superior compartment of the mediastinum. Anterior. Anterior mediastinum lies below the superior compartment between sternum and the pericardium. Posterior mediastinum extends behind the coronal plane through the posterior aspect of pericardium. Middle compartment lies between the anterior and posterior divisions of the mediastinum. Mediastinoscopic anatomy. Superior mediastinum contains the phrenic nerves and the superficial and deep cardiac plexus. Superior and middle mediastinum contain a large number of structures that can be explored through mediastinoscope and are usually classified according to the relationship to the trachea, as the mediastinoscopist follows its pathway in order to explore paratracheal areas, and they include structures to the right of the trachea. Blood vessels include right carotid artery, right subclavian artery, azygous vein, pulmonary artery. Nerves: right recurrent laryngeal nerve, vagus nerve, bronchi. Right main bronchus, and the right upper lobe of bronchus. To the left of the trachea, thoracic duct, arch of aorta, pulmonary arteries, left recurrent laryngeal nerve, esophagus, left main bronchus. To the inferior to the trachea, esophagus and tracheal bifurcation. Medial mediastinum. Medial mediastinum strictly should include only pericardium and its contents. For convenience, however, most anatomy textbooks describe highly of the lungs in the medial mediastinum. Anterior mediastinum. Anterior mediastinum merges at its upper end with the superior compartment. Reaches inferiorly to the diaphragm. It contains thymus gland, internal memory artery and vein, internal memory and diaphragmatic lymph nodes, connective tissue and fat. Thank you.